7 warning signs your heart might be in trouble. Hey there, have you ever wondered if your heart is as healthy as it should be? Today, we're going to dive into 7 key warning signs that your body might be giving you when your heart isn't functioning properly. These subtle but crucial indicators can help you take action before it's too late. Heart disease is the leading cause of death in the United States, responsible for nearly 700,000 deaths annually, according to the Centers for Disease Control and Prevention, CDC. That's roughly 1 in every 5 deaths. With statistics like these, it's critical to pay attention to the signs your body may be showing. This video is divided into 3 essential parts: the 7 visible signs, physical indicators that suggest potential heart issues, the 7 key symptom sensations you might experience if your heart isn't in good condition, how to prevent heart disease, practical tips to keep your heart healthy and avoid serious complications. Make sure to stay until the end, because there's a lot of information that you might not have heard before. And don't forget, liking and sharing this video can help more people, especially those who don't have easy access to healthcare. Your engagement could save lives. Let me know in the comments. Do you have a heart condition or suspect you might? And where are you watching from? I'd love to hear your story. 7 warning signs your heart may not be healthy. 1. But frank sign, a crease in your earlobe from now on. You might start looking at people's ears more closely. Trust me on this one. There's a small diagonal crease in the earlobe that might indicate clogged arteries in the heart, coronary arteries, or in the carotid arteries. This is called Frank's sign, named after Dr. Sanders Frank, who identified this link in the 1970s. He noticed that many of his patients with chest pain angina had this crease in their ear. But does everyone with this crease have heart disease? Not necessarily. About 70% of people with this crease have some level of arterial blockage, while 30% don't. However, if you're younger, under 40, and have Frank's sign, it could be a stronger indication of early cardiovascular disease. On the other hand, if you're over 80, it's more likely just a sign of aging. Hair loss on your legs. Losing hair on your legs, especially on the shins and thighs, could be a sign of peripheral artery disease (PAD), a condition where narrowed arteries reduce blood flow to your limbs. Since atherosclerosis, the buildup of fatty deposits in arteries, is usually a widespread issue. If you have it in your legs, there's a high chance you also have it in other arteries, including those leading to the heart. Other signs that might accompany leg hair loss include smooth, shiny skin, cold feet or legs, slower toenail growth. If you notice these symptoms, it's important to check your cardiovascular health. 3. Yellowish plaques on your eyelids, xanthelasma. Ever seen small, yellowish cholesterol deposits around someone's eyes? That's xanthelasma, buildup of cholesterol under the skin. While these plaques are harmless and don't cause pain, they could indicate high cholesterol levels, which increase the risk of heart disease, stroke, and arterial blockages. Interestingly, only 1% of people with high cholesterol develop xanthelasma, but those who do have a significantly higher risk of cardiovascular issues. For arcus senilis, a white or gray ring around the cornea. If you look in the mirror and notice a white or grayish ring forming around your iris, this might be arcus senilis, a sign of cholesterol buildup in the cornea. While this is common in older adults, affecting nearly 60% of people over 60 and almost 100% over 80. If it appears before the age of 45, it might be a warning sign of severely high cholesterol and increased heart disease risk. 5. Bluish or purple skin cyanosis. Have you ever noticed that your fingertips, lips, or toes turn bluish or purplish? This condition, called cyanosis, indicates that oxygen-rich blood isn't reaching those areas properly. While cold temperatures can cause temporary cyanosis, persistent discoloration might suggest blocked arteries, heart failure, congenital heart defects. If this symptom appears, along with shortness of breath or chest pain, seek medical help immediately. 6. Non-healing ulcers on legs and feet. Ulcers, or wounds on the legs and feet that don't heal properly, could be a sign of poor circulation due to artery blockages. People with this condition might also experience leg pain when walking, claudication, cold or numb, feet skin discoloration. These ulcers can be arterial or venous. Arterial ulcers are more serious and typically appear on the toes, heels, or outer part of the foot, while venous ulcers occur on the inner ankle and are linked to varicose veins or blood clots. 7. Swollen legs, ankles, and feet edema. Persistent swelling in the legs, ankles, and feet could be a sign of heart failure, a condition where the heart struggles to pump blood effectively. This leads to fluid retention in the lower body, especially at the end of the day. Common signs include shoes feeling tighter than usual, pitting edema when you press the swollen area, it leaves an indentation, worsening swelling when sitting or standing for long periods. How to keep your heart healthy. Stay active. Regular exercise helps keep your heart strong. Quit smoking. Smoking is a leading cause of heart disease. Maintain a healthy weight. Excess weight increases heart strain. Eat a heart-healthy diet. Prioritize fruits, vegetables, whole grains, and healthy fats. Monitor your cholesterol and blood pressure. High levels are major risk factors. Manage diabetes effectively. Keep blood sugar under control. Reduce stress. Chronic stress harms your heart over time. If you've noticed any of these warning signs, don't ignore them. Schedule a checkup with a healthcare professional and take action to protect your heart. Did you learn something new today? If so, don't forget to like, share, and subscribe to help spread awareness. See you in the next video.